to know what growth means, ask that to a mother of a preterm baby. These are babies which are born before time than they should arrive, and they weigh really less. 5 years ago, I used to design motorcycles, and then I decided to do something more meaningful with my design skills. I decided that I wanted to design medical devices that could help save lives. And I walked into this really small nursery, which is like a pediatric care unit. And I saw these really tiny babies, some which could fit on the size of my palm. They were lying in these glass pods called incubators. Little did I know, 5 years later, I would be dealing with those very small babies. So just to give you some statistics, like why should we deal with these babies? Why are these babies so special? We have around 15 million of these babies being born every year. And these are babies which are presented with the most amount of risk to dying. They really need special care. About 1 million of these do not survive beyond the first week of their life. Why? What are they at the risk of? They are at the risk of falling too cold too early. They are at the risk of catching severe infections. And that's the reason they need special care. Special care has often been seen as something that is high technology, that you need to put in an intensive care unit, and that costs a lot of money. About 30 years ago, somebody called Dr. Edgar Ray from Columbia invented or discovered a technique that needed nothing. It needed the mother or a motivated family member. It was called Kangaroo Mother Care. What that means is you have a small baby and you need to provide 3 important things to make it grow or to help it grow. You need warmth, you need nutrition, and you need tender loving care. What that technique simply meant was to keep the baby in skin to skin contact with the mother's body between her breast or if on a family member. You could get warmth from the mother's body, which was the best radiator anybody could have ever designed, and it motivated the mother to breastfeed more frequently than she would if the baby was lying in an incubator. Isn't that a wonderful invention? I mean, you needed nothing. It came almost free of cost. It didn't cost anything to the infrastructure. And then you would wonder what is happening to babies today. And you would see that after 30 years of this discovery, Kangaroo Mother Care is still implemented less than 10% globally. We at Laerdal Global Health, a not-for-profit, have big goals to help save lives of mothers and babies. We believe a motivated and a trained healthcare worker will make a huge difference, and we believe that training leads to therapy. We have partnered with several other organizations in developing training tools and design solutions to help train healthcare workers and to help them in their tasks of saving lives of mothers and newborns. Here you see a training tool and a therapy tool that we have developed for a training program called Helping Babies Breathe. How effective is this training program can be gauged from the fact that a recent study that covered more than 80,000 births in Tanzania showed a dramatic drop of 47% in mortality caused by this small disorder called birth asphyxia. So that really convinces us that training can lead to better therapy. Following up on that, and to make sure that these newborns, these preterms that are not surviving, we devise new tools and training programs for special care for small babies. In this picture, you see a breastfeeding simulator and a preterm simulator. Training need not be boring, classroom-oriented, but simulation-based, which is more effective, wherein you connect with the heart and with the brain. In our design process, and here I'm going to talk about how can you have design help babies grow. Very often than not, we start with a single question. In our case, we wanted to keep these babies warm, and so we asked, how could we keep these babies warm? When we realized that Kangaroo Mother Care was the most effective solution, sometimes even better than incubator care, we had nothing to design. I mean, you needed nothing. You needed the mother, and you needed the child to be kept in skin-to-skin contact. So our question quickly changed to how could you get mothers to do KMC, because they were not doing Kangaroo Mother Care. So with that question, when we approached different geographies where KMC was said to be successful, we realized that KMC is indeed successful in these small pockets, but the quality is lacking. And we wondered if to make KMC more successful, did the world miss a mother-centric approach? What could that be? So we took upon our task with a focus on accelerating the uptake of Kangaroo Mother Care. Why is Kangaroo Mother Care not perceived as quality of care is because even sometimes healthcare workers, doctors and nurses think it's a poor man's solution and an inferior alternative to the incubator, which is not so. For the mothers, it meant that somebody was trying to put the onus on them, wherein the nurses are supposed to take care of babies. They didn't see that. The perception was very weak. But more so than ever, people just didn't know about Kangaroo Mother Care. It was not visible to anybody. And certainly, if you imagine that you have to hold a baby continuously for up to 20 hours, it certainly doesn't make a desirable task for anybody. So how do you change this? Probably Kangaroo Mother Care needed to be more visible, more desirable, and of course, you wanted to make a perception change about this. And we asked ourselves, could we do this? Now, if you look at this, I kind of always give this example from my childhood. Kangaroo Mother Care did not have a face, and probably we wanted to bring a more visible face to it. In my childhood, my parents, they were trying to teach me values of saving. And they could have given me a plastic bag or a pouch and told me to go around and collect all the coins. And I wonder if I would have done that. But they gave me this nice piggy bank, an earthen pot, and it had no other meaning. It had a small slot. And all I could do with that was to put all the coins that I could find in my house in it. And that led to a train of me running around finding coins. Probably we wondered if you could have a well-designed and ergonomic, a very easy to do KMC binder that could hold the baby very comfortably for the mother, would that be the piggy bank image for Kangaroo Mother Care? But that's an assumption, and good design does not work on assumptions. You need to fail early. So we build in our design process, we first build and we share. We share as quickly as we can with users. In the early phases, we build to understand. We want to know how users will react to this. Users who have known KMC, users who have not known KMC. What you see in this picture is a rural woman in Uttar Pradesh, and we presented, she had been counseled for KMC, and we presented the solution as a choice if she wanted to use it. And we went back and asked her how she felt. And every time we did this, more and more often, we got hints and we got reactions we had never anticipated before. But it also kind of led to a growing conviction that this was an approach we wanted to follow. This instance is a very interesting story. We hardly found fathers doing KMC, and it's not a mother's duty to provide warmth. Anybody could do that. This is again from rural Uttar Pradesh, where with our partners, we had gone and introduced the wrap to the mother who had an elder child, the first child. She was an 11-year-old girl. And when we went on a follow-up trip, we were surprised that the father, who was slightly more educated, was already trying to do KMC. You will notice that KMC requires skin-to-skin contact, but he is keeping the baby over his t-shirt. And we got curious what led to that motivation for him to do that. It was the young 11-year-old child who had seen us deal with the mother, who had passed on this message after the father got curious what was this new product that he was seeing at his home. And he felt like trying, and he felt rewarded doing that. And that was when we were convinced that this is an approach we want to take forward. We were trying to design for a big geography. We were trying to design for Africa, we were trying to design for Norway, we were trying to design for India. It's not a poor man's solution, it works for everybody. And one size doesn't fit all, but we were ambitious in our goals to see what was a common agreeable design solution that led people to adopt to it. On the left picture, you will see that this grandmother, who was initially reluctant, kind of adopted this device when we added a small gold tassel to it, which suggested to us that people are looking at it much more beyond just providing therapy care. They're looking at it as an image for themselves. It's an extension of their clothing. And that means we had to bring in or tune ourselves as fashion designers for a small amount of time to build that aspiration value in this product. We often build with the common user, with the user within our team, so that the design is not necessarily owned by us, but by the users. And we love it when our partners and the users proclaim that that design is theirs. These are the numerous iterations that went through towards a more unified common design. And after several iterations, The design message became loud and clear. We build and we share so that we kind of have no assumptions. We get closer to the people, but more importantly, we build to fail early. So that reduces the cost and the time that takes for development of such simple solutions. In the later parts of the design, when we have been convinced with an idea, we build to refine. We kind of make design iterations internally within our team, and then we bring back these iterations again to the end user. What you will see in this video are two of my extremely good colleagues from my office in Norway, and we are trying to get how intuitive one of the two designs could be. We are testing with our regular staff in the company cafeteria as volunteers, and we are gathering insights. And we make those fine adjustments to fit and finish and understanding whether one design is better than the other. And when we take it back to the end user, you will often notice our assumptions were very different from how an end user reacts to it. There's this mother who had a very small child. This is from Malawi. And you will notice when she wears the wrap, she's walking like a fashion model. She is not worried about how the fit is. She's not worried about how easy is it to put on. When she puts on, she has transformed herself into a fashion model. And that is what we love to see. We often go and try in different geographies. We want to make KMC approachable to Africa. We want to do it for India. And there are some very smiley pictures from different parts of the world where people have tried to adopt this product and have made us happy when we see their smiles. The wrap, which we now call as Care Plus, is just the beginning. We do not believe that one single solution is going to solve the problem to accelerate the uptake of Kangaroo Mother Care. We need a more holistic approach wherein the health system, the health workers, the mothers, the community, everybody is a part, and it becomes a normal practice as it's not seen as a different from one baby versus the another. But more importantly, what we would like to suggest is that innovation is not about having a new idea. We often have wonderful ideas and we see glossy presentations with nice slides, but innovation is all about impact. And a great idea, when it gets used by an user, is actually the conclusion of a growth of that idea. Perhaps not, it grows beyond that when the user modifies it and redesigns it for themselves. But we are a small team. We are a team of about 20 people located in 3 geographies, in Tanzania, Norway, and India. And our goals are really ambitious. We want to make a difference to 400,000 lives every year. So you might want to wonder how we do that. And collaboration makes it possible. We have our partners and alliance partners who often get embedded in our design processes and often take charge of the products once they are designed. We would achieve very little by our own, and that's why, in the words of one of my very good colleagues, we would rather tend to build our relations on trust rather than on contracts. We are not hesitant on sharing our ideas at a very early stage. In concluding, I believe that most big problems of this world can be solved with some clever design thinking, very often very obvious, simple ideas. Kangaroo Mother Care being one of them. If implemented globally, Kangaroo Mother Care has the potential of saving about 500,000 newborn lives, and that we believe is an idea worth sharing. Thank you.